Okay, I'll go ahead and kick things off, just give you a little overview. So my name is Audrey Flood, and I am with the Tiffin-Seneca Economic Partnership, where I'm a development manager. We are putting on a series of webinars during this time to help businesses on various, several different topics. Beth, are you able to hear me through there now? We're getting some echo.
Some feedback, I'm not sure why.
Okay, I'm gonna mute myself on the phone, see if you can hear me through your computer now. Can you hear me through there?
Can't hear you, no.
All right. I'll go ahead and
Can you still hear me now?
Yes.
That's worse.
Okay, can you hear me now?
Any feedback now?
A little. Can you hear me?
No.
Okay. All right. I'll have to keep this on then. We'll adjust as we go. Again, sorry about the technical difficulties, everyone. So again, the Tiffin-Seneca Economic Partnership is here to help and support businesses. And right now, we thought that one of the ways we could do that is through a series of free webinars on many different topics. Today's topic is health and sanitation, and we are lucky enough to have the Seneca County Health Commissioner, Beth Schweitzer, here with us to give you a little bit of an overview and to answer your questions about anything health and sanitation related. All right, so Beth, you want to go ahead and introduce yourself and give a little overview?
Okay. I don't know if this is going to work. Does this work? Does this work now for you? You can hear me? Okay, good. And it may be some of my technological challenge that has made this not work. I apologize for that. Sometimes I'm still not real savvy when it comes to these things. But I'm very glad to get to speak with you today, because I know one of the things that has been really tough in the last few weeks is the whole essential business situation since that order was handed down. And this is an amazing time to be in, no matter what field we're in right now. Whether you're a workplace or for us at the health department, it's definitely different. Unprecedented things have occurred. Of course, I always have to talk about what we can do to prevent this. And probably if there's the one thing that I think is most important, it's that social distancing. So within the workplace, if your workplace is still operating, as I'm kind of assuming those of you who are on the call today are, hopefully. I feel badly about those who have not been able to open, but that social distancing is really the most important thing. If we don't come in contact with someone with COVID-19, we are not going to get COVID-19, and it is a very easily transmittable disease. That's been one of the issues with this. It's highly infectious, so that has been a real problem. We need to have your workforce feel safe to go to work, and I know many people are frightened by this. And one of the things that's happened, of course, we have received lots of calls of thinking that perhaps their workplace is not in compliance with the social distancing and the other methods that we need to use to keep our workplaces clean. So if you can, you really need to keep your employees separated by that 6 feet. Having the ability to get to a restroom to wash hands. I know hand sanitizer, that's made this tough too, because that's been at a premium. But having that hand sanitizer available for your employees to use is very important, and giving them enough breaks that they can run wash their hands, especially if they're going to be moving from their workspace and going in to grab some food, or going someplace where they're going to be touching other common areas that other people may touch. The one thing that we can do now that has become highly suggested, and they are really wanting everyone to start doing this, is wearing these face masks. Now, they are not going to necessarily, I know this sounds odd, the primary purpose of it is not necessarily to protect you, but for you to prevent passing those germs along to somebody else. And so if everybody's wearing them, it's going to make double the barrier. I don't know if any have had a chance to listen to Dr. Acton on the 2 o'clock press conferences with the governor, but she talks about all the things we are doing being like slices of Swiss cheese. one slice of Swiss cheese has a hole in it, so it's going to be easy for something to go wrong, for that infection to be transmitted. But the more layers you have on it, the social distancing, the having your mask on, the washing your hands, the using the hand sanitizer, each one of those things is going to help keep you from catching it. So just remember that. We want to be transparent about this and let people know what's going on so that they are aware. And one question that has been asked quite often of me is, when are we going to have widespread testing? My answer to that is they are coming out with more tests, but the problem with testing people just, randomly testing everyone is that if you don't have the infection, of course, you're not going to test positive, but even if you do have the infection, and they're saying there are a large number of us that do not show symptoms when we get that infection. So then again, that there's more the reason for all those layers of keeping us protected. But if we follow those guidelines, that's going to make the fact that we don't have those tests readily available help us to be better prepared. You could be tested and early on have the illness, and you may not test positive, so you would get a negative that is, in essence, might give you a false sense of security. So we will see how that moves. We keep hearing we're going to get more. In fact, on the call today, they said we were going to be getting some, but then we need to determine how we're going to distribute those and whose hands they are best able to be utilized in. Businesses, I want to remind you, if you have customers that come into your business, you need to be determining just how many people can come in to a waiting area and still maintain that social distancing. So don't let too many people come in that more than can be accommodated. Now there is a board that is called the Resolution Board at the state level, because there were, determining what was an essential business was not something I ever dreamed that I would need to do. That's not something I learned about in school. So that came as kind of a surprise to us. So we've done our best to interpret that, but of course, many different people allow for a number of different interpretations. So what they did was created this board down at the state level that if there are two counties that are not in agreement on what should be done, and I'll give the example, dog grooming has come up. And there are several different ways this can be ruled, and this is still a little up in the air, because the guidelines stated that if this were in a freestanding clinic, like a veterinarian's clinic, that was not an essential service there. There were certain services that we would consider essential within a veterinarian's office, and dog grooming was not. There's also another clause that says if your business is located in your home and you are the sole proprietor or employee, then you can do that. So that brought up this question, can that be done? Can dog grooming within your home be all right to do? And we did determine that. Now, unfortunately, that went to this resolution board and they said, no, it's not essential. But several of us contacted them and said, we need a little more clarity, because it does say home operated business are allowable. So that's just one of the issues that's occurred with determining this essentialness. And we also are asked now, how long is it going to be before we hit that peak and that flattening that curve is happening and it's going to go on the downside? We still cannot say for sure when that is. Dr. Acton did say today that we are seeing some flattening spots in that peak, some plateaus. So that's what we're hoping for. We'll kind of see how things go and how many cases are increased, the number of deaths that increase, just to see if we are at a plateau, or if we're still going up, or if we're on the downswing. But what they want you to do as an employer, if you have not been able to remain open, get ready for the return of your workforce by doing all those things we've talked about. Again, making sure they can stay social distance, having things disinfected, and allowing the employees to be able to use hand sanitizer, not letting people congregate in the lunchrooms or in the cafeteria. So you will be hearing more than too about where COVID-19 is occurring in places where, like long-term care facilities, making people aware of that. People have asked about the zip code and the census tract identification. They are working on that. There may be a point where we can release that information. We've made a lot of headway, and I appreciate your help in making that work in your workplaces. And we will continue to carry on. Don't let down until they say we can let down. They are using lots of good information to keep us informed and to make the determinations that they are. So I really trust in our leadership that we have at the state level to be making good decisions for us. We've got to remember that they've also said that until there is a point where there's a vaccine, that curve may go down and flatten out. But if we do too much too soon, then we could see spikes again. So we want to be aware of that. So that is kind of the point where we're at now, and I'd be glad to field any questions that anybody has. See if I can answer them. If I can't, I'll let Audrey and David know what answer I do find and get that back to you.
Great, thank you, Beth. Yeah, that was a really nice overview of kind of where we're at.
Okay.
So yeah, please.
Now, I can't hear now, so I'll need to have that back on.
Okay, hopefully you can hear that. Okay, so a reminder to everyone, please either raise your hand and we can unmute you and you can ask your question over the microphone, or type in the question box or the chat box and we will get your question answered that way. I have had a couple of questions from people that I can bring to you while we're waiting on people to type their questions in. I'm getting that feedback again. Okay. So first question, Beth, if you can hear me. What are some good ways that businesses can sort of clean, either in preparation for opening back up or if they're open right now, tips for cleaning their business, either processes or products they can use to try to sanitize as best as possible?
If you go to the EPA website, there are a number of products that are mentioned. If you're making your own solution or using some kind of a bleach solution, it's 10 parts to 1, so 10 parts of water to 1 part bleach, and that's a good cleaning product. But as I said, go to the EPA website and look for cleaning products for COVID-19, and they will have a list of what you can use. Those areas where there's lots of common use, where lots of people are going to be touching, those are the areas that you want to really focus on. Anything that someone will come in contact with frequently and they'll be touched by many different people. If you're closed, or if you have an opportunity over the weekend when you're closed to have someone come in and do a good thorough cleaning, that certainly wouldn't be a bad idea too. But just that good, I know we here use bleach wipes to wipe off door handles, doorknobs, the places where people might touch door jambs as they walk through, those places that are easily accessible. We do that at least 2 times a day, if not more, here within the health department.
Okay. Great, thank you for that. Looks like we haven't had any other questions so far from the group. Let's see. Any other tips you can give as far as communicating to customers about the health topic, such as signage, keeping apart, and those kinds?
Yes, I would say that just getting that signage that says 6 feet apart. We've got some signage here if someone's looking for something. If they want to email me and let me know, I probably could get that sent out to you. There are some that are actually in type, the words type. There's some that are actually just pictures showing what what to do and what not to do. So we could probably get some of those pushed out to folks if they would like some ready printed ones. We've gotten those off the CDC and the ODH websites, but I've got them in my file here that I could quickly get that sent out to someone. So my email is bschweitzer, last name is spelled SCHWEITZER at Seneca Health DEPT.org. So bschweitzer at Seneca Health DEPT.org. Just shoot me an email and tell me if you'd like some of those. But I think having those signs up regularly, just as a reminder, the more we see something, you know, advertising tells us that. The more you see a message, the better ingrained it becomes in your head. So you need to see that repeatedly. So that is a good idea to use some signage to remind people.
Okay.
Oh, I forgot about taking temps too. And what we do here, we take those temps ourselves, and then we just have a checklist that we put a check mark and says, okay. I put mine on what it is. Some people have a problem because of HIPAA, but having people know my temperature doesn't bother me at all. If someone comes to work and gets sent home, you probably are going to know anyway who that is, and that they had a temperature that was higher than the 100. It used to be 100.4, now they're saying 100.
Okay. Another question, speaking of the taking temperatures and the thermometers, any tips for people on where to get supplies such as thermometers or other cleaning supplies as we start to open back up? Okay.
That's a toughie, finding that. And I know many people anymore don't have their own personal thermometers. We ordered a couple of the infrared devices, I think it was a month ago, and we just got them today. So I know it's awful that we can't get those things, but do the best you can, and with what you got or with what your employees have.
Okay. Okay. Any other suggestions for good websites to follow for updates on these kind of health things besides the EPA?
Oh, the CDC has good information, and the Ohio Department of Health does as well. They have a coronavirus.gov link that you can go to, and there's lots of good information. There is even a section for employers, so you can go into that section and that you'll find information for you as an employer. And I would invite anybody, you know, if questions pop up, you can certainly call me here at the health department. My extension is 304, and I will be glad to, like I said, answer those questions or find you an answer. I'm up and out of my office a lot, so you might have to leave a message, but please do that. I'm open to talking to anyone, glad to do that.
Awesome. Okay. I think it looks like we don't have any specific questions from the group that we have on the call. Any other tips for businesses if they, you know, maybe are not open right now and can't be doing anything at the moment to just prepare for when we do open back up? And this webinar will be shared also with people later that aren't able to be on the call too. So any general tips for just preparation for opening back up?
I'd say, you know, be flexible with your employees as much as you possibly can. There may be, and I know this isn't always possible for everybody, but I know our HR attorney we contacted early on talked to us about being flexible in this situation. And I would just say, you know, if you've got someone who is in a vulnerable population, older, the over 60, medical conditions that are going to make them more susceptible to catching the virus. You want to maybe be a little more flexible with them. Maybe they don't want to come back to work quite yet. And so just be aware of your employees' needs too, as much as you can. And I understand there are some situations under which you can't make exceptions, but we have here quite a bit just because we felt like we needed to, and we want our employees to feel safe. And we have really been conscious about the 6-foot distance too. People have tape at their doors. you know, says don't come any closer than this. And when we're walking down the hallway, we make sure that we stay on far sides and kind of turn our back to each other. And we've been lucky here. We've not had any illness. So that is fortunate.
One other question I did think of that I've heard expressed by some businesses would be if businesses do start to open back up and then some cases are popping up in that business either within the employees or it's been tracked that customers have gotten it out of the kitchen. What do you see happening in one of those situations?
Well, I would say if we start seeing a lot of that happening, I would say that we probably, if it happened here, I bet it's going to happen other places. Then that might be that spike thing we're talking about. I wouldn't be surprised if the governor and Dr. Ackerman make that decision. Okay, we came back too soon. We've got to shut that down. So I think that's their reason for wanting to wait so that we don't have those issues coming up.
Okay.
Again, sorry about my technological challenges.
We are making it work. Okay, I don't see any other questions from the crowd. So Beth has been great in sharing her contact info already. So it looks like the best way to get a hold of her is that email again, which is bschweitzer@senecahealthdept.org. And the last name again is SCHWEITZER. And then her phone number, if you call the health department, is extension 304. So those are the best ways to get a hold of Beth if you have any more specific questions after that, after the webinar is over. And so please either contact Beth in our office, and we'll be happy to try and answer any other business related questions. So looks like nothing else from the group. Beth, do you have any closing thoughts?
Just thanks for all you have done. We're all in this together. I know it's not easy. My heart really goes out to everyone that this has inconvenienced, and there's certainly a lot, and especially our employees who have lost their living, basically. But access those resources that are available, make those available to your employees, the places they can contact for help. So thanks, everybody.
Awesome. Thank you so much, Beth, for taking the time out of your busy day to speak with us. So, all right. Thank you all for the participants who joined, and to Beth for joining us. And again, like she said, we're all in this together. So thank you for the work you're doing on health and sanitation in your businesses. So we'll go ahead and conclude the webinar with that. Thanks, everyone.
Thank you.